If you live in the United States, the possibility of contracting the Zika virus is still relatively low. But here's what experts from Doctors Hospital at Renaissance now know about the virus and what you can do to protect yourself and your baby.
There are different mechanisms of transmission for this Zika virus. By far, the most important is through the mosquito bite. Okay. Then there is another way to transfer the virus, is vertical transmission from the pregnant female to the baby. Okay, that's also an important mechanism. There is a third mechanism that has been in the news lately, is sexual transmission of the virus. However, this is more rare. It's not the most effective way to transmit the virus. Okay. And there are other potential ways like blood transfusions or donation of organs. However, they also appear to be very uncommon.
The Zika virus began to spread rapidly in South America, and according to health authorities, between October 2015 and January 2016, more than 4,180 cases of microcephaly were reported in Brazil.
Based on this epidemic of Zika, the main group at risk will be pregnant females because of the consequence that the virus may have on the babies.
The baby is born with a very small head and a very small brain. It's a very serious, usually rare birth defect, but the Zika virus is associated with this unfortunate birth defect.
Experts say that unfortunately, a pregnant woman can transmit the Zika virus to her unborn baby in the first, second, or third trimester during her pregnancy.
The Zika virus has been found in miscarriage tissue, in amniotic fluid, newborn babies, and even placenta tissue.
But the CDC cautions that more research is needed to better understand the link between the Zika virus and microcephaly. The steps that we can take to prevent mosquito bites are crucial to preventing further spread of the Zika virus. Wearing long sleeves and pants and using insect repellent are very important. Another form of prevention, especially for pregnant women, is to avoid traveling to areas where the Zika virus is prevalent. The symptoms of the Zika virus are similar to those of dengue and chikungunya, diseases spread through the same mosquitoes.
The main symptoms to watch for Zika are fevers, usually moderate fevers, then associated with a skin rash, and conjunctivitis or irritation of the eyes, redness of the eyes, and then arthralgias or joint pains that primarily affect the small joints such as the ones from the hands.
If a pregnant woman has traveled to an infected area and she has symptoms, it is recommended by the CDC that she undergo testing for the Zika virus.
The Zika virus transmitted from infected mosquitoes, if it bites the mom, she can come down with the symptoms within 3 to 12 days. That's the incubation period.
At the present time, the confirmation test is a blood test and is done by the CDC laboratories. There are two different basic types of tests. The one that you do on the first week of illness, that's a PCR test. That's directed to identify the virus itself and is the most accurate test. There is a second group of tests that's called the serology that basically measures the antibodies that you produce once you've been exposed to the virus. And that usually turns positive after the first week of illness.
For the rest of the population, it is important to consider that the majority of persons affected by the virus do not exhibit symptoms. Actually, only 1 out of every 5 patients that have been exposed to the Zika virus will be symptomatic. Even health authorities have warned those women who want to become pregnant to protect themselves against the virus.
We do currently recommend from the American College of OBGYN that if a mother has recently traveled to an infected area, that she wait to conceive at least the 3 to 12 days for the incubation period, and if she exhibits symptoms, that she wait longer to build an immune response to protect her and her unborn child.
Pay attention to the news, follow websites like the CDC website that will keep us updated as far as how the epidemic is progressing. There are many things that at the present time are not known about this epidemic and about this virus that probably with time we'll understand a little bit better. So it's very important to follow a reliable source of information like the CDC.
There is currently no vaccine to prevent or specific medication to treat the Zika virus. Experts say the best way to treat Zika is to get plenty of rest, drink fluids to prevent dehydration, take medicines such as acetaminophen or Tylenol to relieve fever and pain, and see your healthcare provider if you have been exposed to or suspect you have a Zika virus infection. I'm Kelly Quinn for Doctors Hospital at Renaissance.